Hi, I'm Phil Vandewalle. I'm one of the physicians at the Strathroy Family Health Organization, and I am the site director here. We have 5 physicians that are working in our family health organization. 4 of them are at this location, and we have 1 at Elsa Craig. The unique features of our site are that we are practicing in an old building. We are hoping someday to have a brand new building, but right now it actually is quite quaint working in here. We have lots of allied health people as part of the family health team that we also belong to, the Thames Valley Family Health Team. So we have social workers here, we have dietitians, we have pharmacists, nursing, and we will soon be having a nurse practitioner. So all sorts of new and exciting things that are happening here. We work out of the local hospital, Strathroy Middlesex General Hospital. It's a 52-bed hospital. We have active surgical beds, and we have active ICU beds, and we have active medical beds. We also have a very vibrant emergency department. Residents at our site work with Southwest Middlesex, which is another one of the teaching sites in this area. So the residents have the opportunity to work with our staff as well as the staff from Southwest, so that is really a varied sort of experience for residents, and they quite enjoy it. Usually they do about 4 emerge shifts a month, 4 to 6, depending on sort of interest and the number of shifts that we actually have available to us. The other thing that we're involved with locally here is that 3 of the 5 physicians actually do obstetrics, intrapartum obstetrics. So we run a clinic every Monday, and residents have an opportunity to work with us at each one of those clinics, and usually get a few deliveries in while they're here for the 4 months that they're here. So that's a pretty good experience, I think, for the residents.
So my name's Mike Ballantine. I'm one of the PGY2s at the Strathroy site from the regional program. I found that the part of the reason for coming to the regional program in the first place was that I liked the layout of the rotation schedule. I liked the flexibility that was built in with it and the ability to work emerge shifts during the family medicine time. In choosing Strathroy specifically, I was sort of up in the air between Mount Bridges and Strathroy, and I liked the layout of the practice here. The group of physicians that work here are pretty easy to get along with, and they're a good group to work with. The first year of the program, I found that when I came in, I was surprised by how much independence you had right away, but it was sort of a nice surprise, and I found that I was sort of getting myself up to speed on a lot of topics sort of fairly quickly, because I was kind of forced to take an independent role in managing the patients. And I sort of have built on that in the second year, and I feel much more comfortable now this year.
I think the difference between sort of a regional site and more of the academic sites is that there's a lot more hands-on things that people get to do. They get to do rounds in the morning with their preceptors. They get to do a lot of procedures in the ambulatory care center. They tend to follow their patients sort of from the nursing home or from the office as inpatients. So there's a lot of continuity of care for residents.
With respect to working in the smaller communities in particular, I've found sort of all through my medical training, from clerkship and electives all the way to now, that in the smaller centers you tend to get more opportunity for hands-on, because there's sort of less hierarchy, there's fewer learners ahead of you. And there's also something that you don't tend to get in the bigger centers, which is sort of everybody tends to know each other and sort of know how the system works a little bit, so you're able to interact with different people at the hospital sort of a little bit more easily than you would be in a larger center.